Hi, folks. I'm Steve Adubato. Let's talk about where we are with the Affordable Care Act, otherwise known as Obamacare, with someone who deals with it every day. He is Gabe Drapos, who is Chief of Staff, Oscar Health Insurance. We were talking right before we got on the air, and you were saying that as it relates to the Affordable Care Act, Obamacare, some positive signs. What are they?
Sure, yeah. You know, especially in states that chose to go with the federal marketplaces, those states that, you know, in the news in the first years of the Affordable Care Act were the ones that you were hearing about as having slow growth, slow adoption.
Back up for a second. Sorry for interrupting. States had an option.
They did.
A state exchange versus the federal healthcare exchange.
That's right. They could choose to set up their own exchange, which is what states like New York or California did, or they could choose to adopt the federal program.
Which New Jersey did.
That's right.
Go ahead.
And so those states like New Jersey or Texas had slower adoption rates. And, you know, a few years back, there were stories around healthcare.gov not working, things like that. There were also, I think, patterns around the states that chose to adopt the federal exchange and those states that chose not to put as much resources behind Obamacare. So
where are we now? So real progress there?
I think there is progress. So we've seen overall across the country, those states have caught up to the states that chose to start their own marketplaces. For instance, New Jersey, 40% of members that enrolled this third year of the Affordable Care Act were new to the market. And that's a huge increase.
Go back.
Sure.
40% of those who chose to...
Sure. So 40% of those who enrolled for the first time this year were new to the market. They hadn't enrolled before. So that's a huge increase.
Why do you think that happens?
I think there's a sort of momentum and inertia that needs to be overcome. That, you know, as friends and family start to get insurance, they tell their friends. For instance, with Oscar, 40% of our members come through a friend.
Is that right?
That's right.
Referral. Word of mouth friend.
Yes.
With all the advertising is important, promotion is important. Again, that matters. Word of mouth, key.
Absolutely.
Meaning I had a great experience and someone tells someone.
That's right. Or just the mere fact, hey, look, I can get insured. I can go see a doctor for free for $5, whatever it may be on your specific plan. I have coverage. I know that if something bad is going to happen, I'm going to be protected. That's a powerful message to tell to someone.
The other thing we were talking about, again, which I find fascinating, is the question of public awareness versus confusion about the exchange, about the Affordable Care Act. Where do you think we are there?
I think we still have a ways to go there. Some states, California, for instance, has invested hundreds of millions of dollars a year in this exact thing.
In public education awareness?
Absolutely, just in awareness.
You're saying taxpayer dollars?
Covered California, yes, absolutely.
Go ahead.
And it's still, you know, nationwide, we see that people who were insured for the first time with the Affordable Care Act go to the ER, the emergency room, at a higher rate than anyone else. And things like that, it's because they haven't experienced health insurance. They don't have a history there, having it from an employer or something like that. And so they don't know that they might get hit with a $1,000 bill. And so we need to work on this education. We need to get people better informed about the paths of care that they can take, the costs of that care, and what their plan will cover.
Consumerization of healthcare means?
Sure. I think it means a paradigm shift to health insurers thinking about the consumer first. For 50 years, through just a bizarre history of American tax code, people got health insurance from their employer. And now, for the first time, you have to go directly to a person to get to sell them health insurance. You don't go to an HR benefit specialist. You go to a person, and you have to make a value proposition to them. And by and large, we see people do switch. They are voting with their feet from year to year. This is not a hugely sticky market. In New Jersey, 40% of people, 60% of people who went back to the exchange changed their plans.
They did?
Yes.
From one?
From one to another. Different insurer.
What does that mean to a company like yours?
So I think there's...
Is that opportunity, risk, both, what?
It's both. It's both. Because right now, the sort of inputs to that information to decide where to switch, where to go, are really around premium cost right now, the amount that you pay each month. And so from year to year, you may have people bouncing around for the wrong reasons because while you may go up $5 or $10 compared to your competitor, there are so many other factors that go into this, from the care that the insurer can provide in terms of routing you and being a partner through the system, to the quality of the doctors in the network, everything. It's not just about premium.
So the advice you have for people right now to be their own quote-unquote best advocate is?
They have to be their own best advocate by really doing a bit more research, by not just going to, let's say, healthcare.gov and looking at whatever plan comes up as the cheapest monthly premium, by digging in a little bit. And there are resources out there to help do this, too. New Jersey has the New Jersey Healthcare Quality Institute.
They're great.
They're great. They'll help you.
And they have no, excuse me for interrupting, Gabe. They have no horse in this race.
They don't.
So they provide?
They provide totally unbiased guidance. So do people like Enroll America. I mean, the bias there may be that they want you to get enrolled.
Well, they want people to enroll,
but that's a
but
good
they don't
thing.
tell you where to go.
No. And also localcare.healthcare.gov is a resource where people can go and be connected with a navigator. So somebody who will help them walk through their options. They can set an appointment and really explain everything.
Last question.
Sure.
You told our producers you were thinking that healthcare was, quote, moving in the right direction. Why are you so, I'm not going to say bullish, but positive?
I'm positive because more people are insured. I think while at certain levels in the national discourse, the conversation hasn't progressed, at other levels, people are making moves. People are trying to get to the consumer. All these companies that are trying to work towards making health insurance something that's understandable.
You learned an awful lot about healthcare in the last few years, haven't you?
Absolutely.
It's all good. We're all learning together. Gabe Drapos is Chief of Staff of Oscar Health Insurance. I want to thank you for joining us, Gabe. Appreciate it.
Happy to.
Stay with us. We're right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by New Jersey Council of County Colleges, the Healthcare Foundation of New Jersey, Johnson & Johnson, Cone Resnick, Adler Aphasia Center, the New Jersey Office of the Insurance Fraud Prosecutor, and by NJ Best. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.